Spring is in the air, and for nearly 40 million Americans, that means headaches, congestion, and coughing. We're talking about sinusitis. It's one of the leading health problems in this country and costs over $6 billion in health care costs annually. Well, now there's new hope to treat this chronic condition. Our Ed Crane tells us how a procedure called balloon sinuplasty is helping some patients breathe easier.
For 5 years, Jane Allen has suffered from a stubborn series of sinus infections, a condition known as sinusitis. The symptoms?
Not being able to breathe, being irritable, always having the bags under your eye, headaches, severe headaches.
Now, with a remarkable new procedure, she's pain-free.
I'm 100% different. I really feel good. I can do everything that I want to do.
One of an estimated 37 million Americans with chronic sinusitis, Jane was helped by a new form of surgery called a sinuplasty. Similar to its cardiac cousin, angioplasty, the sinuses are cleared with the use of an inflatable balloon that's snaked through the sinus cavities by a catheter. The man behind the device is Dr. Josh Mackauer, and in this case, necessity was indeed the mother of invention.
I'm actually a chronic sinusitis sufferer myself. I've been to ENTs, multiple rounds of antibiotics, CT scans of the head, and they basically told me that I wasn't bad enough for surgery.
With a background in cardiac intervention, an idea was born.
And as I started to study the sinuses, I noticed that they have very similar intricate patterns as to the coronary arteries.
Fueled by $48 million venture capital dollars, Mackauer and Associates formed a Silicon Valley research firm called Acclarent Incorporated in 2004. Within a year, the sinuplasty procedure was developed and fast-tracked through the FDA approval process. A few specially trained surgeons began using the procedure last spring. 140 have since been trained, including Long Island's Dr. Todd Schaefer. Hundreds more will be trained this year. And those venture capital investors could be in for a windfall. Privately held Acclarent claims sales could reach $1 billion in 5 years. The main attraction?
It's minimally invasive. It goes against the current treatment of sinus surgery because we are not removing tissue and we're not causing any bleeding.
Here's how it works.
We thread a small flexible catheter into that passageway, that tight passageway, and then cause a micro restructuring of the bone that's just in that passageway in a very fast, kind of minimally invasive procedure with a balloon that dilates the bone itself, and then that's removed and you have an open passageway.
It has another advantage over traditional sinus surgery.
With the balloon therapy, the recovery is much quicker. It can be 24 hours overnight. Patients could probably go back to work at that point.
Versus a week or more for traditional surgery.
This procedure is typically performed under general anesthesia in a well-equipped operating room like this one at an ambulatory care center. From sedation through recovery, it takes about 3 hours. And while this operation will undoubtedly help many people with sinusitis, it is not for everyone.
They have more extensive disease. They have nasal polyps. They have disease throughout their ethmoid sinuses. They've had prior surgery.
Sinuplasty can only reach 6 of the 8 sinuses, and while studies declare it safe, any sinus operation is risky.
The sinuses happen to sit next to the eye and the brain. You can't move them away.
For now, many insurance companies aren't covering this 4-figure procedure, but with current sinus treatment costs topping $6 billion annually in the U.S., that position may change. For Market Watch, I'm Ed Crane in New York.